My first two pregnancies, I was in and out of hospital for months. I can lose 20, 30, 40 pounds in a matter of like a month or two, with nausea, vomiting, sometimes going up to 20, 30 times a day. With my second pregnancy, it was a huge challenge for my son. At the time, he was 5, and so mom wasn't home for almost all of his kindergarten year. When we were expecting this little guy, it was a little bit frightening for us because we just moved here 2 years ago and we have no family down here. I was admitted for a little bit at the South Health campus. They told me that they might have to keep me admitted for a while. This was, for me, one of the worst things that could happen. As a mom, I'm like, oh my goodness, how am I gonna do this? And it was pretty frightening. At that point, the Complex Care Hub was proposed to me.
The Complex Care Hub is a virtual inpatient unit that operates on a hospital-at-home model. And I think one of the ways the Complex Care Hub has changed patient and family-centered care is that we're able to give patients back some semblance of control at a time in their life where they might not have had that.
The Complex Care Hub has two teams that work together. We have a hospital-based team that is comprised of a physician who oversees the care plan, and then we also have nurse navigators at both sites that work with the physicians to develop the care plan. We then have a home visiting team, which is comprised of the community paramedics. They are the eyes and ears of the physician in the home, so they do the assessments, they do our diagnostic testing, and then they also help us to identify issues that may be barriers to accessing care that we may not have seen in the hospital.
I was a little nervous because it was going to be like in the home setting, and I just was trying to envision what this would entail. But once we got set up, I felt incredibly supported. You feel like you actually are more involved with your care than you are in the hospital. They talked about the plan openly with you, and you really felt like you had some control back.
I think the Complex Care Hub for patients is so important, and it has such increase in patient outcomes for them because they're at home. When you're at home, you have access to your support network, and they're not limited by visiting hours. When you're at home, you have your personal items, you have your bed, you have your food. And these are all parts of healthcare that we know make patients better faster. There's nothing but benefit there for everybody involved.
We know from previous research and experience that the longer that a patient stays in the hospital, the more susceptible they are to things like hospital-acquired infections, deconditioning in the hospital, and there's also the psychological impact of not being around your home environment and your loved ones.
The system right now is overwhelmed. So anything we can do to provide a high level of patient and family-centered care, at the same time a high level of patient safety, and improve the patient experience is something we need to endorse.
We have the ability to just turn on a dime. We can extend the call, give more time, have instant access to that physician, and if other subspecialties need to be called in because of the way the program is structured, we have access.
As an emergency physician, one of my fears is sending a patient home where I'm not quite sure if they need to be admitted. I don't know when they're going to see that family doctor, and I don't know what their home environment is like. Complex Care Hub bridges that gap. It allows us to know that the patient is going to get great wraparound care, they're going to be at home, and it's going to be safe. And then what we hear from primary care providers is there's often a gap in communication. So they don't know that their patient's in the hospital, they don't know their patient's been discharged. One of the things Complex Care Hub does very, very well is the warm handoff to the primary care provider, so everybody knows the plan.
One of the additional benefits of being in the patient's home is that you get to see where they're at on a daily basis. And so if I go there and I see that they're sleeping in bed, and before they were up at 9, there's a good chance that their health is declining. And as they start to improve, you can watch not only the patients, but their entire family, their whole support network kind of turn around with it, and you can just see the whole energy rise. And for me, that's been a very rewarding part in changing the practice that I get to see.
The care the Complex Care Hub offered, an opportunity for me to be home, really made this whole process just a completely different experience. Every night I got to snuggle and hold my children, and I didn't feel like I was missing out on their life. I emotionally did way better. Even though I was sick, I knew that my loved ones were there and I could see them whenever I wanted. This program offered them stability. It offered them the supports they needed, which was they needed their mom home. I just can't thank the team enough for caring. You're a person to them, you're not just a patient, and you really do build a relationship with the team. I'm really thankful for that.